Hi everyone, this is Matt. We're continuing our series on interventional electrophysiology, and today we're talking about sudden cardiac death. Sudden cardiac death has been researched a great deal over the last 30 years or so, and some of the things that they found out are the following. People with unusual or abnormal pathways or circuitry in their heart are some of the people who could fall victim to sudden cardiac death. This could go undiagnosed prior to that, and sometimes they're actually young people, athletic people who, and there are a number of incidences every year where all of a sudden an athlete collapses and dies, and it could be detectable in some cases with an EKG. So they're looking at perhaps changing the norms for athletes in terms of getting clearance to compete to do an EKG. Other people who are at higher risk for sudden cardiac death are people who have had significant heart attacks. They have areas of their heart tissue that are capable of producing abnormal heart beats from the ventricle, which could lead to rapid ventricular tachycardia and perhaps degrade into ventricular fibrillation, which could lead to death. There are people who have had infections in their heart, either known or unknown to them, and this can cause also this type of rhythm disturbance where you're at higher risk for producing the ventricular extrabeats, which could turn into extended ventricular tachycardia at a fast rate, which could cause a degradation to ventricular fibrillation, which in turn can also lead to death. There are people who have what they call idiopathic dilated cardiomyopathy, and we'll break this down. Idiopathic means of no known or clear reason. Dilated means there is a dilatation of the heart and the heart muscle. Cardiomyopathy is an infection, essentially, of the heart and a dysfunction of the heart. So this excess tissue of the heart can be a source of, again, extraventricular beats, which could turn into extended ventricular tachycardia, and maybe at a fast rate, and then again could degrade into ventricular fibrillation that could lead to death. There are many different ways that these people can be treated in regards to prevention. The most common is the implantation of a cardio defibrillator, implantable cardio defibrillator. And this way, when the heart goes into these dangerous rhythms, it essentially shocks the heart, and the heart rhythm disturbance is terminated. So research continues intensively into sudden cardiac death. Greater understanding is gained from all these studies. It is unfortunately something that in some cases is not known that the person is at risk in terms of younger people. But with these EKGs that could be done for athletes, that is a way to perhaps prevent some deaths in young people, and sometimes they're athletes. And with other people, they're learning more as to the profile of people who are at high risk for sudden cardiac death. So essentially, if anyone detects some fluttering in your chest or feeling weak or dizzy after some type of chest discomfort, it could be a heart rhythm disturbance. And that's the advantage of looking into the heart rhythm disturbances or the symptoms, because you never know what it might be. Of course, you don't want to think right away that it's something as serious as these types of heart rhythm disturbances, but it just reinforces the importance of getting checked. And that's it for today. Have a great day.